The kidneys are vital organs that play a crucial role in maintaining the body's balance. However, they are susceptible to damage and diseases. This video will discuss different strategies to help the kidneys regenerate and repair, including stem cell therapy and tissue engineering. Understanding these approaches can assist medical professionals in treating kidney diseases effectively. Stem cell therapies hold promise for restoring kidney tissue and function. Various types of stem cells, like embryonic and adult stem cells, have shown potential in promoting tissue regeneration and improving renal function. However, challenges like cell delivery and ethical concerns must be addressed before widespread use. Renal progenitor cells are cells in the kidney that can renew themselves and become different types of renal cells. They are important for kidney development and repair. Researchers have found markers and pathways associated with these cells, which could be used to improve kidney repair. This could lead to new treatments for kidney diseases. Epithelial to mesenchymal transition, EMT, is a cellular process where kidney cells change their characteristics, affecting kidney development, fibrosis, and repair. EMT activates fibroblasts and causes tissue scarring but also helps regenerate renal cells. Studying EMT regulation is essential for developing therapies that support positive outcomes while suppressing negative effects. In kidney injury, inflammation plays a crucial role, and resolving inflammation is vital for tissue repair. Inflammatory mediators like cytokines, chemokines, and growth factors control the interactions between immune and kidney cells. Pathways like NF-kappa B and JAK/STAT regulate these mediators and aid tissue regeneration. Disrupted inflammation can hinder kidney repair, but targeting specific mediators and pathways can help promote efficient regeneration. The WNT/beta-catenin signaling pathway plays a crucial role in kidney development, regeneration, and repair. Activation of WNT/beta-catenin signaling promotes cell proliferation, survival, and differentiation, which are vital for renal tissue regeneration. Dysregulation of this pathway has been associated with kidney diseases, including renal fibrosis. Modulating WNT/beta-catenin signaling holds potential as a therapeutic approach to enhance kidney repair processes. However, the intricate balance of this pathway must be carefully regulated to avoid unintended consequences, such as aberrant cell growth and tumor genesis. Fibrosis, characterized by excessive deposition of extracellular matrix components, is a common feature of many kidney diseases. In the context of kidney repair, fibrosis can impede functional recovery by interfering with the regeneration of normal renal tissue. Understanding the molecular mechanisms underlying fibrosis is crucial for developing therapies that target the fibrotic process and promote kidney regeneration. Various profibrotic factors, signaling pathways, and cell types contribute to fibrosis in the kidney. By identifying key players involved in fibrogenesis, researchers aim to devise strategies to prevent or reverse fibrosis and enhance renal repair. The extracellular matrix, ECM, is vital for kidney regeneration. After injury, damaged ECM is broken down and new ECM is synthesized. MMPs, TIMPs, and other enzymes are involved in this process. Proper regulation is necessary for tissue repair and prevention of fibrosis. Insights into ECM remodeling can aid in developing treatments for efficient kidney regeneration. Angiogenesis, the formation of new blood vessels from pre-existing ones, is crucial for kidney repair. Adequate blood supply is necessary for the delivery of oxygen, nutrients, and signaling molecules essential for tissue regeneration. Growth factors and signaling pathways, such as vascular endothelial growth factor, VEGF, and Notch signaling, play pivotal roles in regulating angiogenesis during kidney repair. Disruption of angiogenic processes can impair tissue regeneration and contribute to the development of chronic kidney disease. Enhancing angiogenesis through targeted interventions holds promise for promoting efficient kidney repair and functional recovery. Cellular senescence, a state of irreversible growth arrest, has been implicated in various age-related diseases, including kidney dysfunction. In the context of kidney regeneration, cellular senescence can have contrasting effects. Cellular senescence in renal cells can promote tissue repair by halting the proliferation of damaged cells and initiating the regenerative process. However, excessive senescence can impede kidney repair by impairing cell function and altering the cellular microenvironment. Deciphering the mechanisms underlying cellular senescence in the kidney and identifying strategies to modulate its impact on tissue regeneration may lead to novel therapeutic interventions for kidney diseases. Growth factors play a crucial role in kidney regeneration by promoting cell survival, proliferation, and differentiation. Growth factors such as hepatocyte growth factor, epidermal growth factor, and transforming growth factor beta, TGF-beta, are involved in various aspects of renal repair. These factors modulate cell behavior, stimulate ECM remodeling, regulate immune responses, and promote angiogenesis. Harnessing the regenerative potential of growth factors through targeted delivery and modulation of their signaling pathways holds promise for enhancing kidney repair processes and improving patient outcomes. Biomaterials and tissue engineering approaches offer innovative strategies for kidney regeneration. Biomaterials provide scaffolds that mimic the native kidney microenvironment, promoting cell attachment, proliferation, and differentiation. Tissue engineering techniques involve the seeding of renal cells onto these scaffolds to create functional renal tissue in vitro or in vivo. Advances in 3D printing, biofabrication, and stem cell technologies have revolutionized the field of renal tissue engineering. These approaches hold great promise for the development of patient-specific therapies that can overcome the limitations of traditional transplantation and enhance kidney regeneration. Translating research findings into clinical practice is crucial for the development of effective therapies for kidney regeneration and repair. Clinical approaches to promoting kidney regeneration encompass a broad range of strategies, including stem cell-based therapies, pharmacological interventions, surgical techniques, and lifestyle modifications. Clinical trials evaluate the safety and efficacy of these approaches and contribute to evidence-based medicine for the treatment of kidney diseases. Building on foundational research, ongoing clinical studies aim to improve patient outcomes and establish therapeutic interventions that can be implemented in routine clinical practice. In conclusion, there are many complex cellular and molecular mechanisms involved in kidney regeneration. Studying topics such as stem cell therapies, inflammation, and tissue engineering can lead to improved treatments for kidney diseases, benefiting patients worldwide.